I'm Dr. Steve Ambrusco, and I'm one of the pediatric hematologists here at Roswell Park Comprehensive Cancer Center, the clinical assistant professor of pediatrics in hematology oncology for UB. Blood disorders in children are actually relatively common, or conditions in which we would see children for a blood condition or a question about their blood. We see the entire gambit, so iron deficiency anemia, sickle cell disease, thalassemia, aplastic anemia. So we are basically the referral center for Western New York. So the entire catchment area is where we see patients with our combined program between Roswell Park and Oishei. So that is actually one of the benefits of bringing children to our center, is because we have the combined strengths of both programs. Oishei Children's Hospital is the only freestanding children's hospital in all of New York State. So we have the resources of that to provide for our patients, but then we also have all the resources here at Roswell Park Comprehensive Cancer Center. Some of the unique things that we're able to provide here at our center is our bone marrow transplant program, which we obviously see outpatients here at Roswell, but the actual bone marrow transplant itself is performed at Oishei. So we are able to do that down to infants, and have done that. So being able to do both autologous and allogeneic bone marrow transplants is incredibly important, and being able to do things like newer cellular therapies like CAR T-cell therapy, which at Oishei and Roswell, we did the youngest patient ever to receive CAR T-cell therapy. My primary job is as director of our Sickle Cell and Hemoglobinopathy Center of Western New York. So I take care of every child in Western New York with sickle cell disease, every child in Western New York with thalassemia, and other types of hemoglobin disorders. We take care of kids from birth until typically around 21. This is a very unique population that has a high level of need, and we didn't always have all those resources before, and to be able to tap into the resources here at Roswell has been just otherworldly for many of these patients. Another thing that's unique to our program that we started a few years ago is a Vascular Anomaly Center at Oishei Children's, where it's a multidisciplinary clinic for children with vascular anomalies. The most important thing is that we are not just a hematology center, we are a pediatric hematology center. So the expertise given to children is incredibly important. It's not just going to your doctor, seeing the nurse, getting your blood pressure taken. Children have special needs, families have special needs. So being able to say that we have psychosocial supports in place with child life psychologists, social workers, different psychology fellows that we have with our program is exceedingly important, and that is something that we have on both sides of our fence as well. And our teams actually work quite closely between the psychosocial staff that we have at Oishei as well as Roswell, being able to support our families in so many ways. Because when you're taking care of a child, you're not taking care of just the child, you're taking care of the family.